So I'm a board certified child, adolescent, and adult psychiatrist and have helped over 250 PMHNPs gain clinical confidence in their psychiatric diagnosis skills, treatment skills, and actually helping their patients get better and making more money for themselves. So in this video, we're going to cover follow-up visits. If you ever practice in outpatient psychiatry, you know that follow-up visits are part of the procedure. So what initially happens is that the patient comes in for an initial evaluation, then a diagnosis is made, treatment is administered, and then the patient follows up for either medication adjustments or changes that need to happen or labs or whatever it may be. But there's a right way to do follow-up visits and a wrong way to do follow-up visits. So I'm going to share with you the right way to do them, what I've learned in medical school, in residency, in fellowship, and now as an attending psychiatrist, so that way you don't mess up with your follow-up visits. So for context, I run a concierge private practice. And so in this private practice, patients pay me hundreds of dollars for a 30-minute follow-up. So the most important thing that I have to do is make sure my patients get value. They need to get value out of each visit that happens. So I'll give you two separate examples. Yesterday, I saw this patient who is doing very well, and we had made some medication changes, and so she is doing rock solid. And now she's pretty much on maintenance, and we follow up once every 3 months. And so, does she really need to follow up? Like, not fully, right? A simple text like, "Hey, I'm doing great, just renew my meds," would have been great. Like, that could work. But right, I want to keep my practice going, and so the daily check-ins helps me, help run my practice, right? It's revenue for my practice. But I also have to make it valuable for her, so that way when she goes, she doesn't feel like, oh yeah, this was a waste of $300, $400. She feels like, oh yeah, I got value out of this visit, so therefore it was worth it for me to keep following up with this doctor. So what we did in this visit was we touched on the medication for like maybe 5 minutes, but the rest of the time we touched on her goals. Now, what does she want to do? What does she want to accomplish now? How her family is doing. I gave her some advice regarding her son, because I'm a child and adolescent psychiatrist. So what I was doing is that even though only 5 minutes of that session was focused on her clinical psychiatric treatment, the rest of the session was still me giving value to her. So that way she says, yeah, I love this doctor. I want to keep seeing this doctor, and I want to keep on helping him, or like keep on getting help by him. Whereas fast forward to another patient. So with this other patient, we're trying to adjust the medication doses, and like stuff isn't fully working. And so I'm still making tweaks here and there to his medication regimen. So in that session, we spent the entirety of the time talking about the patient's symptoms and the changes that we were going to make. Point being is that you want to make sure the patient is getting value in all of their visits. So I'm going to break down some ways that we can do that, which I already alluded to. Number one thing, of course, is the following up with your interventions. So this is the highest priority in every follow-up visit. So every time you see the patient, you'll make some kind of recommendation, whether it's, okay, take this medication, increase this dose, decrease this dose, get this lab, start this supplement, pursue this therapy, do this genetic testing, start this exercise program, whatever it is, you will make some kind of intervention. And so now your job is to follow up on that intervention, meaning you check if it happened or not, how well they did it, any challenges and struggles that they had. Are they going to continue to do it? Was the intervention successful? Things that are holding them back. These are the things that you explore. Like, you explore the intervention in detail. It's not just, okay, yes, did you take your medication? Okay, so what time of day do you take it? Are you still taking the same dose? Did you miss any doses? Did you increase or decrease doses? Like, patients will change up doses without me telling them to do all the time. And so that's important to follow up on that. Did you have any side effects? What did other people say about your medication or your results? What symptoms are you experiencing now? What side effects? Have the symptoms gone up? Have they gone down? Have they stayed the same? You want to follow up on the intervention. That's what In most visits, that's what you're going to spend the majority of your time doing. So that's obviously the one thing. But then the second thing, which leads to this, is to prioritize. So what this means is patients might have multiple complaints and multiple things to address, and you may not be able to address all of them in a 30-minute follow-up. Like, there's probably no way, especially if it's a complex patient. So what you have to do is you have to prioritize. This means prioritizing the things that you target. For example, like, okay, I'm only going to target the depression today. We're going to save the anxiety and ADHD for later. Or I'm only going to target this medication today. Any other changes we're going to leave for the next time. And so what you can do actually is ask the patient this one question. So if we had to focus on just one thing today, what would that be? Or out of all these things that we've covered, what's the most distressing for you? By you prioritizing, the patient can actually get a meaningful result in their outcome rather than you just kind of like briefly touching in on things. And then also it sets you up for, as a provider, you want a long-term relationship with the patient. So by prioritizing and not trying to do everything at once, it sets you up for a long-term relationship down the line. So a mistake I've made is, so I've started doing a lot more integrative evaluations, which means I talk about medications and therapy and lifestyle and diet and genetic testing and blood work and like gut health testing, all of this extraneous type of stuff, and try to put together sleep health, putting together a comprehensive plan for the patient. I should do that at the initial visit. But then I found that the patients would follow up and like they wouldn't have done anything. And so the reason was because they got overwhelmed. Like, wow, I have to do all this to get better. And now I've kind of realized and tapered back. So now especially in my initials, I might only focus on like one or two things and be like, okay, let's start this. And then down the line, we're going to add in other stuff. So even just yesterday, I saw a patient who we're treating for bipolar depression. And so I said, okay, let's start this medication, Lamictal. And now we're going to start just one supplement, omega-3s. And then we're going to get some blood work because it's been a while, but that's it. Like, just 3 simple things. And that's all we are going to do. In the past, I would say, okay, well, you should also be on like a ketogenic diet, and exercise can help you regulate your sleep. And now let's get your sleep hygiene good because that will precipitate bipolar disorder. So all that stuff. And I asked her like, hey, do you want to touch, like, do you think we should explore lifestyle interventions now, or do you think we should wait? And she said, why don't we wait on that? So I said, perfect. So that's the key here, is prioritizing, obviously in your initials, but also especially in your follow-ups because the time is limited. So prioritizing. So the next thing you want to do is reflect. So I consider myself, quite honestly, a master at reflecting. Like, I feel like I'm a mirror. I will go through entire follow-up visits without like me saying anything of like my own input. And half of it's like 75, 80% is just me reflecting back what the patient's saying. So if the patient says, oh yeah, like I have this and this problem, so I can either summarize, be like, oh, so it sounds like you're struggling with this and that. And they'd be like, yes. Or I could say, wow, it sounds hard, or sounds painful, or sounds stressful, right? And they're like, yes. Or I could say, or I ask a question that leads into the next thing. But very little of it is me offering input. And that's actually what patients want. They don't want someone who kind of paternalistically talks down to them, is like, okay, this is what we're going to do. I'm the provider, you're the patient. Like, this is what's going to happen. And like, I'm going to spend all my time talking. They don't want that. Like, people love to talk. Patients especially love to talk. That people love to talk about their problems. So let them do that. Like, let them vent it out and like get it out. Of course, you don't want to spend all the session venting about the problem, because they're there for a solution ultimately. So you have to guide them towards that solution, and you have to do it in a expert manner to where they still feel validated and talked about, but you're still guiding the interview. So that way, in that course of that 30 minutes, you are able to still get to the treatment part of the follow-up visit. So that's where reflection can really come in, is that it can help but it can help to make the patient feel that what they're talking about is valued. And especially if they might not have a lot to say and you need to fill some time, Like, for example, like let's say the patient says, oh, I'm depressed, and your plan is, okay, great, I'm going to go up on your Zoloft. Like that could take 5 minutes. But by spending that time reflecting and delving a little bit deeper, that will allow you to spend more time on the visit, so the patient feels a better connection with you and they feel like they got more value out of the visit. So that's that. And then, so now let's say you've done all that. Like, for example, in the case of my patient who, like, literally we only need to spend 5 minutes on her psychiatric treatment because she was doing really well. So then the next thing is you can ask about relationships. This includes family, significant other, like boyfriend, girlfriend, kids. For example, so with my patient yesterday, I asked about how her husband was doing. I asked about how her kid was doing. Her kid's a teenager and is getting into some like teenage problems. So like as a child adolescent psychiatrist, I gave some advice on that, even though obviously that kid is not my patient, but I'm still helping this mom get value out of the visit. How the significant others are doing. Her brother, the patient's brother had a heart condition. So I asked how the brother was doing. So I asked how, and then, but the key is you always relate it back to them. So it's not just like, oh yeah, the brother's doing great or the brother's having problems. It's like, okay, so how is this affecting you? Are you feeling stressed from your brother's health condition? Are you feeling overwhelmed from your son's teenage drama? Whatever it might be. Are you feeling like I have a patient whose husband is a alcoholic, and so it causes her a lot of stress. And so, like that's something that we'll discuss is, okay, how is this affecting you? And the same patient, like her mom is ill, so she's a caretaker. So I ask, okay, how does this affect you? So it's asking about the relationships, integrating those relationships into the visit, but making it relate back to the patient. So now the patient feels like you care, right? Because you do, right? So the patient feels like you care and they're getting value at the same time. So relationship. So, and then the next one is goals. So this is one that I love to do because like in that case with the patient, like there was nothing else really to talk about. So now I spent a lot of the session talking about her goals. Okay. Like what does she want to do? Like what's next for her? What are her 3-month goals? How does she want to improve her life? What kind of thoughts is she having regarding that? And so she said that, yeah, she feels like she's not having that many goals right now. So something she's changing. So she's thinking about volunteering somewhere or starting like working at a store, right? So I explored those with her because like now those are what her goals are. And so I have another patient who, wanted to become more into activism, but then also wanted to do some gardening. And so those are goals that I explored with them. And basically I'm trying to build up their autonomy and their self-sufficiency because all this stuff will carry over. If they are able to self-sufficient, they're able to achieve their goals, their confidence will get better. They're going to feel more motivated. That's going to help their psychiatric health. And then and that in turn is going to help their goals and their feeling of well-being in life. So this is one of my favorites. A little side one too that you can cover is hobbies, which kind of relates to goals in a way, but not fully, because hobbies are something that a lot of people lose touch with, they lose track of. And so by you talking about them and relating it to how it helps them and how it improves their life. It's like, for example, if the patient likes sports and you like sports, it's not like you just spend 10, 15 minutes talking about, okay, the game that happened last night. That's not how you do it. How you do it is, the patient might say, hey, I watched the game last night. So you could say, oh, okay, like, so it sounds like you're connecting with your hobbies. Does it help you connect with friends? What does that hobby do for you? Do you find you have enough time to integrate this thing into your life? Things like that. Basically, you use that hobby as a context for how it fits into the patient's life and how it helps the patient grow. Basically, it's not just like, oh yeah, let's talk about sports or video games, for example, for 10 minutes. But, this kind of stuff, it makes you feel like a real person and it makes you feel connected to them. You could say like, oh yeah, the game last night was great. Or like in my case for video games, the patient might be into video games, and I'll say, oh yeah, like that's a great game. And in fact, I use hobbies a lot to connect with kids and adolescents. But it's not like I focus on that, and because that's not the point. The point is to use the information that you get to help the patient. And this is the skill of integrating these type of therapy soft concepts into the psychiatric visit to help the patient way more than just medications. Because at the end of the day, the patient comes to you because they want value. So they want value, of course, in terms of psychiatric treatment, but also the psychological benefit of connecting with you. So make sure that your visit is just filled with value, and that's your goal, to give your patient value in the any way that you can. I've had visits where I've talked about business advice, for example, to patients, because patients are either starting their own business or like improving it. So they're like, I'm not a business coach, but I'm giving value. Or like patients might ask me career advice. For example, I might see other professionals and they might ask me career advice. And so I can offer that. And so there I'm still giving value, even though career advice is not psychiatric advice. So I hope this helps. This is how I do follow-up visits, and I find I get a lot of value out of it, and patients come back to me and they stay in my practice. So if you really want to understand how to become a master psychiatric clinician, like make excellent diagnoses, treatment plans, feel confident in your visits, and make more money in your psychiatric field as a psych NP or FNP, then definitely consider joining our coaching program, where we've had over 250 students go through so far, and it's grown over the last 6 months to this number. So I think you'll get a lot of value out of that. So check that out, and I'll see you in the next video.